right now two of my favorite guys, I guess, because I'm so happy to be seeing Dipanjan and his better half Avanti, both of whom have been wonderful uh, people to get to know. And yeah, we are here basically to talk about what happened over the last couple of months when we first met the family. When I was back in Bangalore consulting, and Mr. Dipanjan was referred by a mutual friend, and when he came to my office, my consultation room in Manipal, I got to know that he was suffering from what is called a meningioma. A meningioma is basically a tumor that arises from the meninges. Meninges are the covering of the brain. ये ब्रेन का ज्यूरा होता है उसको मेनिंजेस बोलते हैं तो इसका एक ट्यूमर ट्यूमर को मेनिंजियोमा बोलते हैं ये जो मेनिंजियोमा बहुत अलग अलग जगह से ब्रेन के आसपास पैदा हो सकता है मगर pardon my Hindi is not the best but I'll try my best. So the meningioma can arise from various parts of the brain and the spinal cord system. It could also occur in the spinal cord. So in this particular case, Mr. Deepanjan had a fairly large meningioma. That is what I noticed when I first saw the scans. It was a fairly large meningioma in a very, I would say, difficult, critical. I don't know how you would put it, but in a very important area, what we call the skull base. Skull base is the bony foundation, I keep telling my patients, on which the brain sits. The bony foundation between the ears, behind the eyes, on which the brain sits, is called the skull base. So Deepanjan had a fairly, I would say, large tumor in the middle of the skull base, involving multiple areas. Usually, meningiomas are restricted to one area, but here in this particular case, it was going into what we call the intertemporal fossa, the temporal bone itself, the entire temporal bone which houses the ear and more important parts thereafter that and the brain itself intracranially. So this tumor was going into multiple areas. Dealing with such a tumor is not easy. Dealing with a tumor that is going through multiple areas is not easy because surgery being the only option. Of course, radiation is an option for smaller tumors, but a tumor of this size obviously requires surgery. And when we were thinking about surgery for this particular area, surgical approaches are always focused on certain areas. So there is an approach from the front to deal with the front part of the skull base, the lateral part, and the posterior part of the skull base. For a tumor going into all these areas, mapping out a surgical procedure was a challenge. And I think there was a surgery in the past as well, and this was not adequately addressed due to the fact that mapping out a surgical strategy to deal with all these areas effectively, or most of them, is was something that was had to be discussed. So when I met the family, I knew straight away that there was no lack of motivation, so they wanted to obviously get it done and make sure Mr. Dipanjan was very clear in what he wanted and what his history was, and the family was very supportive. I saw that they would walk in tandem with our efforts and what I was planning. So this was very, very important because it's very important that the patient and the patient's family understands that we are here to do the best for the patient, and the surgical approach being planned is to be done in a certain way, and what are the consequences, what are the risks involved. All this had to be mapped out, and understanding this and being cooperative, being very mature about what was going to happen was something very important, and I found that vibe straight away. So that is where we immediately got along, and I should, in fact, compliment, thank Deepanjan and Anjali for the support that came by, which is very important for doctors, especially when we deal with such important tumors and such difficult surgeries. It's very, very important that there are no over expectations, and there's no untoward pressure on the surgeon and the surgical team, because that really then complicates the situation. So here I had the patient and the family extremely educated, extremely understanding about the situation, and therein we had the starting point towards a plan that eventually bore fruit, wonderful results, and I'm so happy to have undertaken the procedure, leading the team. It was a team of surgeons, and eventually we had a great deal of success. We had a fantastic surgery where we could not only remove the tumor, but we could also do a facial reanimation. Which involves multiple procedures again. The facial plastic team, which is again a part of our skull base team, uh, went ahead and did a simultaneous ipsilateral is on the same side of the tumor surgery, ipsilateral facial plastic reanimation, and also hearing restoration, because Mr. Dipanjan had lost his hearing, and this also needed to be addressed. And I'm happy that we could do all of that in one sitting. And this led to this. I'm sure you are aware of the fact that we operated for close to 34, 36 hours. And it was more than one day. We started in the morning, went in the afternoon, the next day. So it was a very long procedure, which included three aspects: tumor removal, facial reanimation, and hearing restoration, all in one surgery. And you see the result. Mr. Dipanjan is here, having gone through that surgery, having, of course, he's been through a lot, and most patients, all patients who go through a surgery like that, and I'm sure he'll have his experience to share with. It's not a pleasant task or a pleasant experience to go through a surgery of that nature and recover, but grossly, there have been no complications. We could expect CSF leaks, we could expect obviously intra-operative complications. So thankfully, none of that happened, and we could come out of it without any major problems. And we are here today to share with you our experience, not only to, this is not a promotional exercise. Yes, it's hosted by Manipal and all, but this is also to let the public know that such things can be done. It's very important. The only motivation that I have in addressing you, because I have a busy practice back in Bangalore. There are many patients waiting for me. The reason I took my time out to come here and address all of you is to let the public know that it's possible to remove some of the baddest of tumors, or really large tumors or difficult tumors here in India, here in India, in our own hospitals, and do things what the world would be envious about. That there are very few people. I mean, I don't want to, at the cost of sounding immodest, I have to tell that there are very, very, very few centers in the world which would do all these things together and come out of it successfully. So we are here to share this experience, and I'm sure Mr. Dipanjan and his better half would want to add.